Hello, my name is Charles Staats, and this is my psychoeducational skills video. The target population that I've chosen are white, non-Hispanic males, age 26 to 34, that are using methamphetamine. So, what is methamphetamine? Well, methamphetamine is a stimulant drug that speeds up the brain and the body. It is made from poisonous ingredients such as battery acid, fertilizer, drain cleaner, lantern fuel, just to name a few. It's usually a white, bitter tasting substance, powder. One form of the drug is a crystal-like substance that is shiny with bluish white-looking rocks. It can be administered by swallowing, intravenously, smoking, or snorted. The drug itself will produce a euphoric feeling that often users will repeat doses to get that high again, often resulting in binge and crash patterns. Now, as far as the impact that methamphetamine has on this target population, and go through the 4 different areas. So beginning with physical, the physical effects that it has are decreased appetite, weight loss, sometimes can be quite extreme, nausea, severe tooth decay, which can result in a tooth loss, skin sores from picking at skin, thinking that bugs are crawling on the individual's body. There can be cardiovascular problems. Users are also at high risk of infectious disease such as hepatitis B and C, as well as HIV. Seizures, very severe sleep patterns, intense cravings. There can be sexual problems such as increased sexual stimulation as well as sexual dysfunction. And those are just to name a few. As far as the social impacts that methamphetamine has on an individual, it can cause a strain on personal relationships, family, any social relationships. They're at high risk of arrest due to theft and other related criminal offenses. Violent behaviors with family are well documented, and this includes also extending out to the societal impact that it has. One thing I wanted to note was that in a study that I found conducted by Independent Rand Corporation in 2009, estimated economic cost to society of methamphetamine use was at between $16.2 million and $48.3 billion. The study found that the most common expenses due to meth are the result of the quote intangible burden that addiction places on dependent users and their premature mortality, and from crime and criminal justice costs. I thought that was pretty significant to include. Um, as far as emotional impacts that individuals will suffer for emotional impacts: depression, anxiety, irritability, apathy, suicidal and homicidal ideations, mood disturbances, blunted emotions, being less aware of their feelings. These users can this can be a motivating factor for someone using the drug, because users who might want to escape from their painful memories or difficult life experiences. The cognitive impacts are essentially a structural and functional changes in areas of the brain that impact memory, impair decision making. There's risk of stroke, risk of epilepsy. There's paranoia, delusions, and confusion, inability to grasp abstract thoughts, disorientation. So those are just of the few that are very significant. As far as the percentage of this population, according to the national surveys on drug use and health from 2015 to 2018, using 2010 census data, the estimated rates of past year use were 8.7 for men and 4.7 for women. The highest estimated rates were the highest estimated rates were among adults aged 26 to 34 at 11, and white non-Hispanic at 7.5. Moving to the treatment approach, I've decided to consider 3: motivational interviewing, cognitive behavioral therapy, and contingency management. So motivational interviewing is a directive client-centered counseling style. Elicits behavioral change to help clients to explore and resolve ambivalence, as well as activates the capacities that we all have to change. So cognitive behavioral therapy is based on the goal to, or focuses on challenging or changing unhelpful thoughts or behavior, improving emotional regulation, and developing personal coping skills that target their current problems. Contingency management is essentially, it reinforces desired behavior by rewarding the individual for evidence of positive behavioral change. And this could include monetary rewards, vouchers for the individual, such as a negative drug test, and that can be done weekly, 2 times, 3 times a week. So that's the basis of that. I have chosen these 3 due to some of the research that I have found that indicates that these combined are the most effective for addressing methamphetamine use dependence with individuals. I'd like to at least provide a little bit of background on my decision with this. One research studied males in particular doing home-based brief intervention motivational interviewing, and found that it increased engagement in treatment programs. The other study that I looked at was a review of how CBT, cognitive behavioral therapy, and contingency management, how effective they were in with patients who had a methamphetamine use dependence disorder. And both studies were very yielded pretty positive results. In general, most information that I've come across indicated that those were, in combination, some of the best approaches to use together. So, in my approach to this particular treatment, I thought that it would be important to utilize motivational interviewing to essentially establish good rapport with the patients that I'm working with. I think it would be appropriate in the sense that it's as I mentioned earlier, it's not a very confrontational approach. It's one that can easily guide the social worker and the patient into a direction where they can identify what is it that is causing them problems with their use. What do they like about it? What are some of the things that might motivate them to change? Exploring some of the things that they may not have thought about. So I thought that was extremely important to include in this approach. And in combination with that, I thought that CBT, cognitive behavioral therapy, would be appropriate in the sense that a lot of people with substance use history, there are a lot of problems with their perceptions, their beliefs about themselves, which this just is an underlying factor of why they may have started using in the first place. So it seemed only appropriate to include that, not only with just the research that shows that it's an effective approach with methamphetamine users, but it can address some of the underlying issues, help create more effective coping strategies, and essentially address what those distortions are in their thinking. It's a lot of people have those. We all have those. So it's no different with anyone that's suffering from methamphetamine abuse. Moving on to the contingency management, I thought that this was a great idea because I think that not only with what the research shows, but that people need some kind of incentive, especially in those initial stages of recovery. And no matter what the actual reward be, I think that it's a very powerful way of keeping someone focused and essentially rewarding them for the progress that they're making, because that's important for individuals to know that they're doing something good for themselves, for their family, for everyone involved. So I thought that was extremely important piece to put in with this approach. And one of the things that I wanted to include in this approach with the cognitive behavioral portion is a thought record. The thought record essentially is a way for the client patient to work through certain thoughts, certain triggers that elicit certain feelings, the automatic thoughts that they have. And this particular thought record is something that I would go through with the clients and work with them through. This essentially is something that I think each session myself and the client patient would go through. Each time they would be asked to take their thought record home, and after they've been taught how to use it, then to come back each week and share what they have documented and kind of work through those thought records with them. I think this is important because it starts to get the patient involved in how they're making a deliberate effort to make those kinds of changes and identify what is it that's constantly eliciting these negative feelings, and they can start to kind of narrow those down. So I think that's really important. Lastly, so as far as expected outcomes, I think that based on the research, I would have to say that my expected outcomes would be to at least have some kind of a retention in engaging in the program, and of course abstinence. With some of the limitations in the studies, I'm a little I'm not too optimistic that the individual might actually stay abstained for too long. I think I'm just going to be realistic about that, just due to working with some patients that do suffer from methamphetamine abuse. So in all, I would have to say that my realistic expectation of the outcomes with this type of treatment approach would be for at least retention in the program, increased education on their use, the effects that it's having, and at least short to long-term abstinence. That would be the desired outcome. So that about sums it up. So thank you for watching, and good night.